Hi, I'm Dr. Lucky Seacon, and today's Fertility Fact Friday is all about mosaic embryos. Okay, so what the heck is a mosaic? When you do PGT, the whole purpose of pre-implantation genetic testing is to get a sample of the cells on the outer part of the embryo that one day become the placenta and send them off for genetic testing to count how many chromosomes each of those cells has. Hopefully, you'll have an embryo where all the cells have 46 chromosomes. That's called a euploid or a normal embryo, and it is suitable for transfer and has high reproductive potential. You can have embryos that are aneuploid or abnormal, where all of the cells biopsied from the outer part of the embryo come back with missing or extra DNA. And then you can have mosaics, which is kind of like an in-between result, resulting from a mixture of normal and abnormal cells being detected in the sample being tested. So why do mosaics happen? Well, unlike when you have an abnormal embryo where all the cells are tested as abnormal, this is not related to things like maternal age. This is because of a random sporadic error as the cell was growing and dividing, and at some point along the way, there's an error and a certain proportion of the cells of the embryo end up abnormal. We've only been able to detect mosaicism in embryos more recently because the technology keeps getting better and better and has better resolution, where we can now see that there are differences between the cells in the sample. Before, it used to just be looking at the sample as a whole, but now we can actually tell if there's this mixture of normal and abnormal cells. Initially, when we first began to be able to detect mosaicism, people were really leery about using these embryos because we do know of conditions in humans that cause disease or other issues that have been linked back to individuals that have this mosaicism or mixture of different cell lines in their body. So it's not something you can take lightly, but we know that this doesn't always lead to disease, and there have been live births of seemingly healthy children, although we don't have long-term data yet, but it is possible that the embryo could self-correct along the way as it's continuing to grow and divide into a pregnancy. It's important to note that mosaic embryos have a lower implantation rate, a higher miscarriage rate, and there is always that potential unknown of whether there could be medical problems down the line. So you never do a transfer of a mosaic without extensive genetic counseling beforehand to talk about the specific issues with that embryo. And you should always do prenatal genetic testing in the form of an amniocentesis to get as much information as possible once you're pregnant in the second trimester.